Well, let's turn our attention to this particular story now, and Newsnight is keeping track on the Listeriosis outbreak. Now, according to reports, one person from Namibia has been diagnosed with the disease. Now, Health Minister Aaron Motsoaledi met his counterpart in the Sadc region today to discuss South Africa's Listeriosis outbreak. eNCA reporter Malungelo Booi is tracking that story for us, and he joins us in studio now. Malu, what was the thrust of the minister's message to his counterparts?
Well, Kole, this was an extraordinary meeting of Sadc health ministers. It was called by Health Minister Aaron Motsoaledi. He's the chairperson of that committee, if I can call it that. So he was briefing them about the Listeriosis outbreak here in South Africa and what is currently being done to address the problem. Now, the ministers were also addressed by a representative from the World Health Organization and also from the National Institute of Communicable Diseases. But what the minister really was saying is that they were on top of the situation here in the country, doing everything possible to make sure that this bacteria doesn't spread or disease doesn't spread.
Is there agreement, therefore, on the outcomes of this meeting, Malu, that there will be a unified response to the outbreak? That's right.
In fact, all the countries have agreed that they will share information with each other. They'll also come up with strategies, Gole, on how to tackle the problem. Now, remember, Gole, some of these countries don't have the capacity. For example, in Namibia, the case that you spoke about earlier, that this one person who has been diagnosed with Listeriosis, the test had to be conducted here in South Africa because Namibia does not have capacity. And the Deputy Minister of Health in Namibia confirmed that they don't have capacity. And also, one of the things, though, that these countries have to do now is to embark on public awareness.
Talk to me, Malu, about the case that's been identified in Namibia. Is that the only case? Have there been any other cases identified outside of South Africa?
Namibia is the only country that has come out confirmed that they're treating a man for listeriosis. They're saying that they're still under investigation as to how the person contracted it, but they know that he had a ration. But also, clearly, this brings, there was a question that was asked to some of these ministers, and I also asked this question to the Deputy Health Minister in Namibia on whether do they trust South African products. Let's take a listen. Do you trust South African products?
Yes, I'm telling you that the question of trust is always not the biggest question to us because more than 80% of our imports are South African imports. So it will be very unfair for us. But what I would like to put more emphasis in is on the issue that South Africa have dealt with this issue with due diligence. They have come up with a high level of transparency. They create awareness and they work so much in order for us even to become aware.
All right. So, Malu, talk to me then about whether or not the import ban was discussed by these ministers.
Well, that's the first thing Health Minister Aaron Motsoaledi told us, that the import ban was not discussed at all because it's not part of their mandate as health ministers. That issue will have to be discussed by trade and industry ministers from all these countries.
Understood. Thank you very much for that update. That was Malungelo Booi, our reporter here on eNCA.